Right. Since asthma is essentially an inflammatory disorder where the bronchioles are remodeled after excessive inflammation, one must ask what are the factors which would cause the inflammation which leads to asthma? And the reality is that there are an awful lot of environmental factors which can lead to this inflammation, such as stress at the job, or air pollution, or depression is a source of inflammatory factors. Also my diet, the fatty acids that I ingest, especially if they're from beef or chicken, they can promote inflammation. When it comes to air pollution, there are a variety of factors such as diesel particles, ozone, nitrogen and sulfur oxides. All of these can increase inflammation and increase the likelihood of asthma. Much of our predisposition to developing asthma is inherited from our parents because there are a variety of genes which either promote inflammation or lessen inflammation. And there are varying forms of these genes, and some forms lead to more inflammation and thus a greater likelihood of asthma. And so one can inherit varying forms of pro-inflammatory proteins such as cytokine hormones or bradykinin, TNF-alpha, some of the prostaglandins like D2 and F2, or a variety of the metalloproteinases or MMPs, especially numbers 8 and 9, which are going to remodel the tissues and make those bronchioles thicker. And there are also a number of genes who oppose inflammation, and varying forms thus would decrease the risk of asthma, such as TGF-beta, dipeptidyl peptidase, some of the corticosteroids, some of the interleukins, and other prostaglandins. And so asthma is essentially an inflammatory disorder caused by excessive inflammation and the tissue remodeling which follows. And we have a host of genes which either promote inflammation or oppose inflammation. And depending on which of the varying forms that we inherit, our predisposition to asthma can change. So thus, our levels of inflammation which predispose us to asthma are both influenced by our environment and things such as cigarette smoking and air pollution and stress, and the genes which we inherit. And one must consider the interactions between these, because good genes such as functional GST enzymes, which would reduce the inflammation resulting from air pollution, can compensate for a bad environment which contains air pollution. In contrast, the very common polymorphism of not producing a functional GST enzyme, that's a bad gene, this could perhaps be overcome by a good environment, in which one isn't exposed to air pollution. And so therefore, given that genes can compensate for a bad environment, and a good environment might compensate for bad genes, one has to consider the interaction between one's genetic inheritance and one's environment.